wonder what is functional medicine and what is the difference between registered dietitian, nutritionist, holistic nutritionist, integrative nutritionist, functional medicine nutritionist, or functional medicine health coach? So if these are the questions, I have the answer for you. I'm going to share the screen in a little while, and we are going to look at what is the difference between functional medicine approach and conventional approach, and how can functional medicine nutritionists help you find the root cause of your health issues so that you can flow through your days with ease. If you were to look into the dictionary and use Mr. Google, you will see that functional medicine is an evidence-based approach that addresses the root cause of chronic disease by understanding how food and lifestyle choices can influence the body system and how to restore the balance. Ooh, this is a really wordy, long question. So in short, what does it mean? We have approach, we dig deeper. We are not looking only at what you eat, but what's eating you, what are the emotions. Because in the center of the matrix, as I'm going to share a little bit later, is the mental, emotional, and spiritual well-being. And so we listen. We have more time to spend with you, and we listen. When was it the last time that you felt well? What was the trigger of your current health issues? And we are digging deeper until we find it. And evidence-based because, of course, we are also using the latest research. We are having the references from PubMed as every other medical professional. But we are also using cutting-edge laboratory tests and other clinical tools. These ones are sometimes covered by the insurance and sometimes not. So, of course, we are trying to help you in the best possible way, and whatever the collaboration with your medical professional would allow to be covered by the insurance company, we do. And then everything else that's not covered, we first evaluate whether or not you really need it. And so what are the tests about? So let's say that you come to me and you say that you are bloated like a balloon every single day, no matter what you eat. So we know that food is not the culprit. It's the underlying issue. Is it the triggered immune system? Is it a leaky gut? And so, for example, in one of the stool tests, we are looking at these functional medicine scores. So we are looking at the maldigestion. We look at the pancreatic elastase, so the organ pancreas. Are you able to produce the digestive enzymes? Yes or not? Inflammation. Of course, calprotectin is for Crohn's disease, ulcerative colitis, and frankly, it's autoimmune disease. But sometimes we are looking at other markers like secretory immunoglobulin A that is in the mucus of your gut. Do you have inflammation? Yes or not? Dysbiosis, yeasts, candida. Do you have recurrent urinary tract infections? When you get up in the morning and you look at your tongue, is it white? Have you noticed any changes in your skin, in your nails? So that's what we look at as well as the results of your stool test to discover which bacteria is overgrowing or which yeast. And then we do the protocol for this. Or metabolic imbalance. Maybe you have noticed change in your body shape. Maybe you are growing the belly fat, love handles, despite eating healthily. Maybe you feel tired or your sleep is not what it used to be and your digestion is compromised as well. Is it the metabolic imbalance? Well, that's what this marker will tell us. Infection. And here, number 10, 10 being the worst of the worst. Have you been traveling to Peru, Mexico, like me, bringing dangerous parasites that do not cause only gut issues, but also mental issues? You might feel the seasonal depression, for example, and you don't know that it might be coming from the parasites. So we look at this as well. Or maybe you are going through the perimenopause and you experience hormonal bloating, or you have suddenly histamine intolerance that you didn't have before. And again, you are blaming the food, yet there are underlying issues. So we might be running the hormone and metabolite urinary test. And why urinary test and not the serum? Because serum shows you what's in that moment in your body, but it doesn't show you whether or not you are able to break down these hormones into the metabolites and eliminate them from the body and basically use them. And that's why the urinary test might be a better option. So what it tells us about the methylation, which is a process in the liver, for which we need many nutrients, B12, B6, zinc, and so on. And so this will tell us if there is any potential risk of the carcinogenic metabolites, which would be the OH16. In this test, it's not dangerous. It's also going to tell us about the levels of the chronic stress. Is it cortisol or cortisone? How are they balanced? As you can see on this beautiful rainbow, we immediately see which hormones are dominating. So here it's estrogen and estradiol, which might be causing sore breast, hormonal issues, sleep issues, and so much more. The typical perimenopausal roller coaster or menopausal, and of course andropausal for men as well. And the last but not least, what's important is, are you going towards the aromatase, the enzyme that is turning the precursors to the hormones? Is it going towards the testosterone or estradiol? And so this is just the first part of the test, but this test has 17 pages and goes really deep into details. There would be many, many, many more tests that I would be passionately talking about, like cardiometabolic test or DNA tests, but these two will already show you where you are. So eyes are the windows into your soul. And these amazing tests are the window into your unique biochemistry. So that's what we do in a functional medicine approach. And so what is the difference between functional medicine approach and the conventional approach? I would say that conventional is making name it, blame it, tame it. So let's name it. Let's give the disease a name. Okay, you have diabetes, you have Hashimoto, you have this and that. And yes, it's great to name it and then blame it. What are we going to blame? Are we going to blame the genes? Are we going to blame the environment? Or are we victors? Are we responsible for our own health? Tame it. Are we going to tame it with some medication, some drugs that will just suppress the immune system, or putting the cream or plasters on the issue? Or are we going to dig deeper and see what is the root cause and how can we rebalance the overall health? And I hope that you are now saying, I want to rebalance the overall health and I want to feel like myself again. And so then the functional medicine would be for you, because that is a medicine of why that happened, what was the trigger, and that's what we are going to look into. And so here is one example of very complex metrics that we are using. So as you can see in the functional medicine, this is from the Institute of Functional Medicine. This is a clinical decision tree. When somebody comes to us and tells us, I have IBS, I have been blamed, diagnosed to have IBS, which basically means that enterologists didn't find anything. The blood tests are fine within the norm, but you know that something is not quite right because you are bloated, you have pain, you get really stressed, and maybe nobody looked into the gut-brain axis. And so what we do is we gather all the information from you. So we want to see the medical history. Did you do endoscopy? Did you do colonoscopy? What were the results? Maybe the mucosa, maybe there were some hyperplasia, maybe there was something, a little bit of the inflammation, but it wasn't severe yet for the medication. But we want to know that. So we collect all the medical history. We give you the medical questionnaire, asking you questions so that we can dig deeper. And then, of course, we are looking at the blood tests that you might have. We look at all the other biomarkers. We maybe also look at your skin, nails, hair, you name it. And then we organize the information. And then we are digging deeper. So from what you provide us with, we decide if it might be dysbiosis, SIBO, if it can be infection, and we maybe recommend some more tests. So we either write a letter to your medical doctor, if he can send you to the hospital and you do like other testings, or you decide, okay, I just want to do the functional medicine tests, and then we order the stool test for you that comes to your home address, and you just take the sample, and then you phone the DHL guy, and he will collect it from your home. It's super easy. And then we will have more information. And then we, of course, like look at also your stool, because it's very, very important, the Bristol stool test. Are you seeing a beautiful sausage-shaped stool in the toilet 2-3 times a day? You don't need any toilet paper? Well, then you wouldn't be here. And if you see something else, then you are on the spectrum. And so we, of course, look also at your digestion and how we could support you with maybe phytonutrients and the food. But let's not go deeper into this. I just want to show you how we organize it. Yeah. So I mentioned that the mental, emotional, and spiritual well-being is very important. And spiritual, it's nothing to do with religion. Spiritual means whether you know your purpose, whether you wake up on Monday morning absolutely excited about what the day has to bring, if you are emotionally well, or is there any grief, anger, any low vibration energies that are torturing you? And what could you do about it? How is your mental health? Because these 3 aspects of the well-being have then impact on the other areas. You might have seasonal allergies, you might have gastritis, you might have this mysterious IBS or bloating. And so we are looking at it, and we are looking at what is your family history? What could be the trigger? What can be the mediators that make it worse? And maybe what we can change right away. How is your sleep? How is your exercise? How is your nutrition and stress and relationships? And so we want to know about you as many information as possible. So then we put it onto the timeline to see where the problem started. Because sometimes happens that you don't feel them immediately. It grows slowly. And you act only when you are in such a pain. So when we, for example, talk about the leaky gut, which is intestinal hyperpermeability, and maybe you have heard about Dr. Fasano and the marker zonulin that is so famous now. And so we are looking at what you are eating that can be damaging it. And then, of course, the stool tests and blood tests confirm. Yeah. So here are some of the typical symptoms that usually my clients share with me, and then I suspect it might be leaky gut. And then when I get the confirmation from the stool tests, I know exactly what to do. And so, as I mentioned, it's not only about what you eat, but how do you, for example, manage stress? And so I also want to know what is your lifestyle? Because then when I make the recommendations, I cannot completely change your life. That must be something that you have been doing, but we are looking for alternatives. So what are the things that you can do, how you can play in this life? That's what we are looking at. The stress management, when you are sitting on this carpet, going above, and you look at your situation from another perspective, what do you see? And of course, as a nutritional therapist, I am going to look into the deficiencies, how we can support your immune system. Of course, I'm going to educate you about the importance of vitamin D and that it doesn't come from the sunshine, as everybody thinks, or not enough, because you might not be converting it if you have compromised detoxification pathways, and what you can do about it, how we can test it, how many international units you need, and why this immune modulator, this steroid hormone vitamin D, is so important for you. You can see some information in here. Of course, we are going to do temporarily some inflammation, anti-inflammatory diet, so some elimination trial, depending on what we find, because these beautiful mast cells, as you can see on the picture, that are spraying histamine and maybe making your skin itchy or maybe having impact on your sleep and on your mood. So we need to little bit see where you are and what we can do about it. And of course, I'm going to prepare a menu for you and tell you what you should eat. But not only that, because it's not only about the information, but it's also about implementing the skill, because knowledge is power. I read all these books, but do you think that I have all the effortless skills to flow through my days with ease? Maybe not all of them. And so you, right? Nobody is perfect. It's about progress, not perfection. And I believe that prevention is better than cure. And now maybe something whispers in your ear that it's your time and that you really want to say enough is enough. I want to fix my health issues. So I would be delighted to educate you, entertain you, and encourage you to make weekly small steps so that you achieve all your desires and all your goals. And so, if you want to know a little bit about me, yes, I'm a science-based nutritionist and a functional medicine practitioner. I specialize in gastrointestinal issues, bloating, farting, diarrhea, constipation, hormonal imbalances, which is perimenopause, menopause, Hashimoto disease, and even andropause for men, yes, erectile dysfunction, and so on. And of course, mental and emotional well-being, because you must know where you are and what your soul truly desires so that you can shift your identity and make small actionable steps to change your behavior. And I'm using this holistic approach: mental, emotional, nutritional, spiritual, and physical, right? Yes, you need to move the energy. And so these are the associations that I am not registered with all of them. It's my aim to register with all of them. Currently, I am registered with ASCA, which I'm going to show you here. I studied at the British College of Nutrition and Health, and I studied at the Institute of Functional Medicine. So this is continuous education, and it takes quite a long time to become the functional medicine practitioner. So everybody can be functional medicine nutritionist, pretty much everybody, but functional medicine practitioner, it's not for everybody. So here you can see who is eligible. So if you, for example, even want to study, if you are a nutritional therapist and you want to become a functional medicine practitioner, if you have any of these degrees, then you have to go through the certification with Institute of Functional Medicine. You have 4 years for all the courses. And you can see that it's, for example, the advanced gastrointestinal program, hormonal, immune, and so on. So first you have to apply, so showing them all your degrees, and then they either accept you to the program or not. And if they accept you, you just start studying, and then you have to do the exam, you have to do the case studies, and you have to pass the written tests. And then you get the license for 10 long years. So I hope that this short presentation of the functional medicine was helpful, and I hope that you schedule a free discovery call with me, because I would like to learn about your story. What is it that you want to change, and whether you are committed to change it now, not next week, not next month, not next year. It needs to be now.